She had been ignoring her legs for almost 2 years. Margaret was 68 years old, a retired nurse, someone who spent her entire career telling other people to pay attention to their bodies. And yet here she was, sitting in my office, explaining to me that the swelling in her ankles had been getting worse for months, that her left foot sometimes went numb for no reason, that her legs ached so badly at night she couldn't sleep, that she had stopped going on her evening walks because the pain in her calves became unbearable after just a few minutes. She looked at me and said, "I just assumed it was my age, doctor. I thought this was normal." It was not normal. After a full cardiovascular workup, we discovered that Margaret had significant peripheral artery disease, a condition where the arteries supplying blood to the legs become narrowed and blocked. Her circulation had been deteriorating for years, and in that entire time, her legs had been sending her clear, unmistakable warning signs. Signs she had been dismissing, signs she had been accepting as inevitable. Signs that, had we caught them earlier, could have prevented the level of damage we found. Margaret's story is not unusual. In my 30 years of treating patients over 60, I have seen this exact scenario play out more times than I can count. The legs are one of the first places in the body where circulatory problems reveal themselves. They are, in many ways, the most honest part of you. When something is wrong with your blood flow, when your heart is struggling, when your arteries are narrowing, when your veins are failing, your legs will tell you. Every single time. The tragedy is that most people don't know how to listen. I am Dr. Richard Cole, and today I want to change that for you. I want to walk you through the 7 warning signs your legs send when your circulation is compromised. And I want to be specific enough that after watching this video, you will never look at your legs the same way again. I also want to tell you exactly what to do when you notice these signs, because knowing is only half the equation. The other half is action. Stay with me through all 7. Because warning number 5 is the one that most people have right now and have no idea it means anything at all. The first warning sign is one that almost everyone over 60 has experienced, but very few people have ever connected to their circulation. It is a deep, aching pain or cramping sensation in the calves, the thighs, or the buttocks that appears during walking and disappears almost immediately when you stop and rest. Doctors call this intermittent claudication, and it is one of the most reliable early indicators that the arteries supplying blood to your legs are becoming narrowed. Here is exactly what is happening inside your body when this occurs. When you walk, your leg muscles demand more oxygen. They send urgent signals asking for increased blood flow. In a healthy person with open, flexible arteries, that increased blood flow arrives without difficulty. But when the arteries are narrowed, clogged with years of plaque buildup, the blood simply cannot get through fast enough to meet that demand. The muscles begin to starve for oxygen, and pain is the result. The moment you stop walking, the demand drops. The trickle of blood coming through is suddenly enough again, and the pain fades within minutes. This is why so many people dismiss it. The pain goes away when you rest. It feels manageable, predictable even. So they simply learn to walk shorter distances. They stop climbing stairs. They avoid certain activities. They adapt their entire life around this limitation, never realizing that what they are actually doing is accommodating a serious progressive disease. The distance you can walk before the pain begins is critically important information for your doctor. If that distance has been gradually shrinking over months, if you used to be able to walk 2 blocks before your calves cramped, and now you can barely make it to the end of the driveway, please do not normalize that. Change. Please mention it specifically at your next appointment. Say these words: "I have pain in my legs when I walk that goes away when I rest." That description alone tells a vascular specialist almost everything they need to know. The second warning sign is coldness. Not the kind of coldness you feel when the room is cold, but a persistent, localized coldness in one foot or one lower leg that is noticeably different from the other side. I want you to do something right now. Place the back of your hand against your left lower leg, just above the ankle. Then do the same on the right side. Do they feel the same temperature, or is one noticeably colder than the other? When circulation to a limb is compromised, less warm blood is reaching that area. The tissue temperature drops. The skin feels cool or even cold to the touch. This asymmetry, where one leg feels significantly colder than the other, is a finding that vascular surgeons take very seriously. It suggests that blood flow to that limb may be meaningfully reduced. People dismiss this constantly. They wear an extra sock, they use a heating pad, they assume poor circulation just means they run cold. But coldness in one specific limb, especially when it is consistent, when it persists regardless of the room temperature, when it has been gradually worsening, that is your body telling you something important. The third warning sign is a change in the color of your legs and feet. And I want to describe 3 specific color changes that should concern you, because each one tells a slightly different story. The first is a pale or whitish color in the foot or lower leg when it is elevated. When you raise your leg above the level of your heart, when you lie back and prop your feet up, and your foot turns noticeably pale or white within a minute or two, that paleness is telling you that the blood pressure driving flow into that limb is dangerously low. Gravity was doing a significant portion of the work. Remove gravity, and the blood barely makes it there at all. The second color change is a deep red or purple-blue color that develops when the leg hangs down. After that same pale foot is lowered back down, it may flush to a deep, dusky red as blood slowly pools back in. Vascular doctors call this dependent rubor, and it is a classic sign of peripheral artery disease. The third color change is a bluish or mottled discoloration that appears across the lower leg or foot in cool temperatures or at rest. This levato reticularis, a net-like pattern of bluish-red discoloration, can indicate poor circulation, blood that is moving too slowly through the small vessels near the surface of the skin. None of these color changes are normal. None of them are simply cosmetic. Each one is a visible signal that the blood supply to your legs is not functioning the way it should. The fourth warning sign is one that people tend to notice but rarely mention to their doctor because they assume it is unimportant. It is a change in the skin and nails of the lower legs and feet. When the blood supply to the lower extremities is chronically reduced, the tissues that depend on that blood supply begin to show the effects. The skin on the lower legs may become thin, shiny, and taut, almost like the skin is being stretched over the leg from the inside. The normal hair that grows on the lower leg and the top of the foot may begin to disappear, because the hair follicles, deprived of adequate blood flow, simply stop functioning. The toenails may thicken, become brittle, slow their growth, or take on a yellowish, discolored appearance. These changes happen gradually over months and years, which is exactly why people normalize them. They assume the hair loss on their legs is just aging. They assume the thickened toenails are just a fungal problem. They buy antifungal cream and move on. But these changes, taken together, thin, shiny skin, absent leg hair, abnormal toenails, form a recognizable pattern that any vascular specialist would look for immediately. They are the visible, external consequences of tissues that have been running on reduced blood flow for an extended period of time. Now we reach the fifth warning sign, the one I mentioned at the beginning. The one that people have right now in enormous numbers with absolutely no awareness of what it means. It is swelling. Specifically, swelling in the ankles, the feet, or the lower legs. And I want to explain it carefully, because swelling can come from several different sources, and knowing which kind you have tells you a great deal about what is wrong. When the deep veins of the legs fail to return blood efficiently back toward the heart, a condition called chronic venous insufficiency fluid accumulates in the lower legs. The swelling is typically soft, pitting, and worse at the end of the day after you have been on your feet. It improves overnight when your legs are elevated. You may notice sock marks that take a long time to fade. You may notice that your ankles look larger in the afternoon than they did in the morning, but here is what I need you to understand. Swelling in the legs is not just a venous problem. It can also be a sign that your heart is not pumping effectively, that blood is backing up because the pump is weakening. It can be a sign of kidney disease, liver disease, lymphatic obstruction. Swelling that is persistent, worsening, asymmetric, affecting one leg much more than the other, can also indicate a deep vein thrombosis, a blood clot in the deep veins, which carries the very serious risk of breaking loose and traveling to the lungs. Press your thumb firmly into the skin over your shin bone. Hold it for 5 seconds. When you release, does the indent remain? Does it take 10, 20, 30 seconds to fill back in? That remaining dent-pitting edema is alone in the tissue. It means something is not working the way it should. The sixth warning sign is one of the most alarming because it signals that the circulation to a limb has deteriorated beyond early stage disease into something that requires urgent attention. It is a non-healing wound or sore on the foot or lower leg. In healthy circulation, even a small cut or scrape on the foot heals within days. The blood supply delivers oxygen, nutrients, immune cells, and growth factors, all of the biological machinery of healing. But when that blood supply is significantly compromised, the healing machinery cannot reach the injury site effectively, and wounds that should resolve in a week are still open after a month, 2 months, sometimes longer. These are called arterial ulcers, and they are most commonly found on the tips of the toes, the outer ankle, or the heel areas where the blood supply is most vulnerable. They tend to be painful, with defined borders and a pale, dusky base. They do not bleed much when disturbed because the blood supply is so poor. For people with both peripheral artery disease and diabetes, this combination is particularly dangerous. Diabetic neuropathy means they may feel little or no pain from the wound. Reduced circulation means the wound cannot heal, and in the most severe cases, this progression leads to tissue death, gangrene, and ultimately amputation. Every year in the United States, approximately 150,000 lower limb amputations are performed. The vast majority of them are preceded by exactly this kind of non-healing wound. A wound that was noticed, perhaps for weeks or even months, before anyone took it seriously enough to investigate the underlying blood flow. If you have a wound on your foot or lower leg that has not significantly improved in 2 weeks, please see a doctor immediately. Not next month. Not after the holidays. Immediately. The seventh warning sign is one that happens at night when you should be sleeping, and it is one of the most reliably diagnostic symptoms in all of vascular medicine. It is rest pain, a deep, burning, aching pain in the foot or lower leg that develops when you lie flat in bed and is relieved by hanging the leg over the side of the mattress or getting up to walk around. Rest pain occurs because when you lie flat, you lose the assistance of gravity. In a limb where the blood supply is critically reduced, even the small contribution that gravity makes to blood flow matters enormously. When that contribution is removed, the tissues at the end of the limb, the toes, the foot begin to experience what is called ischemic pain. They are not receiving enough blood, even at rest, and the pain wakes you from sleep. Many of my patients describe this as one of the most disruptive symptoms they have ever experienced. They spend nights sitting in chairs or sleeping with their legs hanging off the bed because they have discovered that this position reduces the pain. They don't know why it works, they just know that it does. Rest pain is not a mild warning sign. Rest pain is a sign of critical limb ischemia, a severe reduction in blood flow that places the limb itself at risk. It is a sign that demands urgent medical evaluation. If you are experiencing pain in your feet at night that disappears when you hang your legs down or stand up and walk, please see a vascular specialist this week. Not eventually. This week. Now, I want to give you something you can do today, because information without action helps no one. The single most important thing I want you to do is examine your own legs right now. Take off your socks and shoes. Sit somewhere with good light. Look at the skin. Is it shiny, thin, unusually smooth? Look at the hair. Is it present, or has it disappeared from the lower leg and the top of the foot? Look at the toenails. Are they thick, discolored, slow growing? Look at the color. Is one foot or ankle noticeably more purple, red, or pale than the other? Press your finger into the skin above the ankle and hold for 5 seconds. Does the dent remain? Then feel for the pulse in your foot. Place 2 fingers in the groove just in front of the inside ankle bone. Can you feel a pulse there? It should be steady, strong, and easy to find. If you cannot find a pulse in your foot, or if you find it on one side but not the other, that is a finding worth discussing with your doctor. At your next medical appointment, I want you to ask specifically for an ankle brachial index test. This is a simple, painless test that compares the blood pressure in your ankle to the blood pressure in your arm. It takes about 10 minutes. It requires no needles, no special preparation, and no radiation. And it is the single most reliable way to screen for peripheral artery disease in a primary care setting. A normal result provides genuine reassurance. An abnormal result gives you and your doctor the information needed to act before the disease progresses further. In terms of daily habits, 3 things make the largest difference for leg circulation in people over 60. The first is walking. Even 20 minutes a day of steady, moderate walking, not fast, not intense, just consistent, is the single most evidence-supported intervention for improving peripheral circulation. Walking stimulates the development of collateral blood vessels, alternative routes that blood can take around narrowed sections of artery. It is, in a very real sense, your body building its own bypasses. The second thing is hydration. Blood that is adequately hydrated is less viscous, flows more easily, and is less prone to clotting. 8 glasses of water a day is not a cliche. It is a genuine circulatory intervention. The third is elevation. Spend 20 to 30 minutes each day with your feet raised above the level of your heart. Not just propped on a footstool, but genuinely elevated lying back with your legs on pillows. This position uses gravity to drain the excess fluid that accumulates in the lower legs over the course of the day and gives the venous circulation a meaningful rest. If you smoke, I need to address this directly and without softening it. Smoking is the single most powerful risk factor for peripheral artery disease. It damages the inner lining of blood vessels, accelerates plaque formation, promotes blood clotting, and reduces the oxygen carrying capacity of the blood all at once. The legs of a person who smokes age approximately 10 to 15 years faster from a circulatory standpoint than the legs of someone who does not. There is no medication, no supplement, no procedure that reverses the damage that smoking causes as effectively as simply stopping. If you smoke and you have noticed any of the warning signs I have described today, please take that combination very seriously. I want to close by telling you what happened to Margaret. After her diagnosis, we started her on medication to improve blood flow and prevent clotting. We enrolled her in a supervised walking program. We made adjustments to her diet and her daily routine. We had a long, honest conversation about the warning signs she had been ignoring and why she should never ignore them again. And 6 months later, she walked into my office, walked in, without pain, without stopping, without needing to rest before she reached the exam room, and she told me she had started going on her evening walks again. She said, "I finally started listening to my legs, doctor." That is all I am asking you to do today. Your legs are among the most honest communicators in your entire body. They have been trying to tell you things perhaps for months, perhaps for years. The swelling that gets worse by evening, the calf pain that disappears the moment you sit down, the foot that is always colder than the other, the ache that wakes you at night and goes away when you stand up. None of these things are simply aging. None of them are things you simply have to accept. They are messages, and every single one of them has a meaning worth understanding. Please share this video with someone you love who is over 60, someone who has been dismissing their leg symptoms, someone who has normalized the aches, the swelling, the coldness. You may not realize this when you press share, but you may be giving them the information that changes everything. I am Dr. Richard Cole. Take care of your legs, because every step you take depends on them.